This work is actually a small part of a very large project that we're developing in partnership with the University of Glasgow. A small piece of a very nice team of people. And the whole goal, the end goal of this project, of this section of the project, is to develop deprivation index for small areas in Brazil. And the context for that, as you can see on the top part of the slides, over the last 3 decades, Brazil has been undergoing a very significant economic growth and development. These are the last 3 editions of the census, of the national census, and what is showing here is the Human Development Index. For those who are not familiar with the measure, it's a composite measure of longevity, education, and income. And as you can see, Brazil has been progressing over the past 3 decades. But this process is not going on homogeneously. There's still a lot of internal inequality across municipalities within the country. And if in this we're looking only at municipality level. If we take a closer look, inside a municipality with a very high HTI, we can still have a very dramatic difference across postcodes, across different neighborhoods. This is in the municipality of Campinas, São Paulo, that has a very high HTI, and these 2 neighborhoods are only 9 kilometers apart. So this makes the case that we need a closer look. Looking at municipalities is not enough if you want to capture how deprivation is affecting health in the Brazilian population. So we've been taking advantage of the Brazilian census. We have very good census data in Brazil. Brazil has 5,500 municipalities, but we have more than 300,000 census tracts. So each municipality would have around 50 to 60 census tracts. So we'll be able to break them apart into very small sections. And the variable selection that we did was oriented by a scoping review that was presented by Andrea 2 days before that. And the variables that we used are from the last edition of the census, the 2010 census. We used the dimension reduction approach, and the variables we selected were lack of paving, no sidewalks, no cover, presence of open sewage or raw sewage on the streets, and presence of garbage or accumulated waste. And it's important to remark that those variables are only collected for urban areas, so this would cover around 96% of the Brazilian territory. So yeah, and will cover around 190 million people and 58 million households. And we use the confirmatory factor analysis approach, using a kind of a SEM approach just for that to be more presentable and more clear to understand. And we assessed the existence of 2 underlying dimensions based on the variables that we had. Those were sanitary conditions and infrastructure in the neighborhood. Okay. These are our results. We actually got very good factualities for first round. As you can see, the variables in the top left part of the slides, they separated themselves very clearly into 2 different factors. One for infrastructure and another one for sanitation in the census tracts. We actually have good measures of sample adequacy, good TLI or MCA, and all those interesting statistical stuff. So to conclude, we do find that there is potential for building a small area deprivation index in Brazil, considering the surrounding environment at least. We are pursuing other dimensions for household conditions, literacy, education, and income for the whole index, but looking at the neighborhood condition alone, we do see potential for building such index. We have published, we are underway of publishing a scoping review on that because there isn't actually any measure similar to that in Brazil. The closer level that we can get that covers the whole country is municipality. So we think this census tract-based index will be very useful to monitor health inequalities and mortality in Brazil. And we also may be able to replicate that if we use the census data. So every 10 years, we'll be able to update that. So if you have any further questions, you can email me or talk to me after, and thank you very much.